Hola, buenos días, buenas tardes o puede ser buenas noches. ¿Cómo está? Yo estoy muy bien y preparada para ayudarles con esta preparación para tu sesión de Lingua Meeting con el coach. Estamos en la unidad 3 y estamos hablando de cómo navegar un hospital, cómo llegar a un sitio en el hospital o cómo llegar al consultorio. Vámonos. Okay, Unit 3. It's very likely that you completed 1 and 2 already, and so you have some confidence built up about stepping into this Zoom session with your coach, but it's also possible that this is your very first coaching session. So a couple of reminders. Have your Unit 3 notes handy in your cuaderno that you're keeping as you learn Spanish. Have your phrases for how to navigate communication breakdown handy or tabbed in your cuaderno. Print this, put it in your binder, or copy. You can just cut it out and paste it, elementary style, straight into your cuaderno, so that you can take notes on it and have it ready for you with your coach. These guides are flexible. They give a structure to the conversation and help you know where you're headed. The coach very likely will use things that are not on this guide because it is a conversation and they are trying to help you practice and achieve this goal of giving simple instructions in a clinic, in a hospital, or in any health setting. You'll notice sometimes there are instructions written directly to your coach, especially if you notice, I don't think I'm supposed to know what all of that means. You're correct. It's because it's a note to the coach. Okay? Okay, so let's get going. The first part is always a warm-up. If you have never met your coach before, you're still going to ask, you're going to do name exchange. Okay, so ¿cómo se llama usted? Me llamo Kate, y usted. Or if you ask them first, you're going to say ¿cómo se llama? They're going to say me llamo Maribel. You say, and then they're likely going to say y usted. You say me llamo Kate. And then remember the phrase to say nice to meet you is mucho gusto. Okay? Mucho gusto. And then you can, let me just jot that down. It's a hard one to remember. Mucho gusto. It sounds so similar to how we say I like something in Spanish, but it's not the same. Mucho gusto. Nice to meet you. You can respond. If they say it first, you can respond with the exact same words. Mucho gusto. Or you can say igual. Igual. The G kind of gets lost. Igual. Mente. Mente is the ly suffix in Spanish. So literally that means equally, but we would translate it to likewise. Try that again. So it's not E and then a hard G. The G kind of, it's almost as though it were written G-W-A-L. Igual, igualmente. Okay? So definitely do that in this first conversation if you've never met your coach before. Same thing. Some of these questions, like ¿de dónde es usted? If you've met with Maribel now, this is your third time, you don't have to ask that question again, okay? But repetition is a key to language learning. So even if it does get asked again, great, practice it again, okay? Always in the pleasantries, you're going to be asking how each other is doing with the question, ¿Cómo está? ¿Cómo está hoy? And because it's hard not to when we're asking how someone is doing, we say, how are you today? Is it a busy day? A lot of times we'll tack on a second question even before they answer. So if that happens in your conversation, just say, muy bien, gracias, and then throw it back their way. Y usted, okay? The question, ¿qué hace hoy en la clínica? Remember, they're just asking about your day. And you can say, hoy tengo mucho trabajo, or hoy no trabajo. Let's write that as an option. Hoy, silent H, no trabajo. I don't work today. Hoy no trabajo. Okay? Or trabajo más tarde. Let's build out a few other sample answers. Trabajo más tarde. Or to say at what time you work, say trabajo a las, let's say you have a later shift, a las 8 de la noche. Okay? Muy tarde. Very late. Okay? So pleasantries first is part 1. Then we move into part 2, this kind of activating these key phrases. So the coach may engage with you in these in multiple ways. They may show you images, and then you have to say which of these phrases work. So listen to these. These are commands, and as we talked about in the Get the Essentials video, you can soften commands with por favor. Okay? Por favor can go before the command or after. So they may also present an image and ask you to pick the opposite. They're trying to activate this vocabulary so then it can be used in the role play. So, siéntese aquí, por favor. Levántese. Espere un momento. Sígame, por favor. Siga derecho. Gire a la izquierda. Gire a la derecha. No se mueva, espere. Okay? So they're going to practice those with you so that then you're going to be ready in part 3 to use them. So role play 1 is from the sala de espera to the consultorio. Sala de espera, right, the waiting room, and then into the doctor's office. So the context, again, this is written in English and Spanish for your native speaker coach and then for you. The patient is waiting for their appointment and needs to go to, get to the office, okay? So there's a longer context, like you work at the clinic, the coach is the patient, give them directions to arrive at the doctor's office, or for more context, imagine the clinic is very large, like the HSC, and you are walking them to the appropriate office, okay? Or you walk them to a certain place and then direct them from there. Okay, so think about how you might direct a patient to the office. So you would say, buenos días, sígame por favor. Or maybe you would say, buenos días, espere aquí un momento. Wait here just a minute. And then, okay, sígame por favor. You can say para llegar. Let me add that in there. Let's add it right here. Para llegar, like, para llegar, to get there. Para llegar, do this. To get there, go straight, turn left, turn right, okay? So to get there, para llegar, siga derecho, y luego gire a la izquierda. Y allí está la oficina. Okay? Put together in your cuaderno a few of these, connect some of these phrases together in a way that makes sense. So you might say, good morning, follow me please. And then you're going to say, okay, para llegar, siga derecho, y luego, so, and then, y luego, gire a la derecha. Y allí está la oficina. Okay? Or you might say, buenos días, espere aquí un momento. Gracias. That could be the end. Okay? Or you could say, buenos días, sígame por favor. You could even say, ¿a dónde va? Like, where are you headed? O con quién es su cita. Let me add just a couple more. You don't have to use these. Please remember that you're putting together a few of these simple, let me not use the word simple. You're putting together a few of these short conversations. So, con quién, with whom es su cita. la doctora Fernández. Muy bien. Sígame, por favor. That's with whom is your appointment. Let's just use that one. That one's nice. Okay? So that would give you a little more conversation to build out in these, where you're engaging with the patient and getting them to the office. Okay? To say the office will be right there, or the clinic or the lab is right there, you say, y ahí está el laboratorio. Y ahí está la oficina. Okay? Y ahí está la oficina de la doctora Fernández. The office of la doctora Fernández. Okay? When you write out a couple of these, you might add in cómo se siente hoy, how are you feeling? And then here, this is another way to ask, ¿con quién es su cita? Do you have an appointment with el doctor Flores o la doctora Martínez? Okay? All right. Let's keep going. Part 4. So this one, because again, we're working with simple commands, this is a role play of a simple physical exam. So the context, you are the doctor or nurse, your coach is the patient. So, por favor, levántese. Por favor, siéntese. Respire. Otra vez. So you're saying again. And then maybe there, you say, respire profundo. If you need to tell them inhale, exhale, the H in the middle of the word is silent. Inhale, exhale. Okay? Abra la boca. Diga ah, ah. And then relájese. Okay? Let's okay, so you can tell them any of those. You can put together a few simple ones, or if you think, okay, for a simple exam that I normally do, I also need this other simple command. Look it up and add it to your cuaderno, your notes. I want to take just a second to pause and connect something that we saw in Units 1 and 2 that we just keep seeing everywhere because it's so useful. It's a grammar structure that we could use in a patient exam. Asking someone, can you do this? Can you do that? Puede. Puede, can you? So puede plus the verb. Can you lift your arm? Puede levantar el brazo. El otro brazo. Puede mover la cabeza así. Okay, así means like this. Puede mover la cabeza así. And then you want to say, and like this, you can just say, y así. You just stretch a little more. Okay? So that will give you an extension, even if you don't know the command. You can say, can you do this? Can you do that? Okay? So you can practice a few of those. I think this will be could be a funny part of the conversation because you can have each other practice. So recognizing the commands and then practice giving the commands to see if you're giving them in a way that they can be understood. Okay. Finally, to close off the session, for Unit 3, the coach may ask you some questions. ¿Cómo se siente about the session? How did you feel about that? Bien. Or nerviosa. Fue muy difícil. Okay. They may ask you what part was easy, what part was difficult. And then you could say parte uno, parte dos, or fue difícil, gire. La palabra gire. Maybe that word is hard for you, okay? And then I've asked the coach here if there's time to talk briefly about how clinics function in their Spanish-speaking country. Remember, these coaches are from all over the Spanish-speaking world. And then I've reminded them that to use language that's appropriate for the level. And then finally, for you, in your cuaderno, when the session ends, take a minute, couple of breaths, write down how you felt. Did you feel more confident this time? How did it go? What part did go better? What part did you struggle with? How can you work on that before next time? And then ask yourself these questions. Was I able to do these things, which are our unit objectives? When you've written your reflection in your cuaderno, go to the last assignment in the unit, which is the reflection assignment, and type up some of your reflection to complete the unit. Okay, good luck in your session. Hasta luego.